Good evening, everyone. Let me welcome all my viewers once again today on Heart Mitra for all new experience of this live program. As you are aware, Heart Mitra is created for all of you, and we keep on sharing a lot of information with you related to your good cardiac health so that you are able to manage your heart health in a good way. Not only we share information on a daily basis, but we also invite leading cardiologists from across the country who can talk to you as a friend and answer the questions which you have in your mind on the most important subjects. Today, I'm very glad to welcome Dr. Santosh K from the beautiful city of Mysore. Sir, welcome to the program.
Good evening. Thanks for having me in the program.
Yeah. Today we'll be talking about a very interesting subject, and not very interesting, in fact, but we keep on getting a lot of queries about it, and it's a medical condition of heart, which is heart failure. Many of you keep on putting questions that you want to understand a little more about it. So today we will have a discussion with Dr. Santosh around the same. But before I take in your questions, let me formally introduce him. He's one of the leading cardiologists from the city of Mysore and working as interventional cardiologist and electrophysiologist and associate professor of cardiology at Sri Jayadeva Hospital, Mysore. To begin with, he did his medical studies at Mysore Medical College, and then he moved for his master's degree at prestigious PGI Chandigarh, and thereafter he did his super specialized training in cardiology from Shri Jayadeva Institute of Cardiology at Bangalore. He happens to be the first electrophysiologist of Mysore, and his major areas of interest include preventive cardiology, coronary and non-coronary interventions, device implantations, and also complex cardiovascular procedures. So we know that today we have a guest who is an expert in these matters and would be able to guide us in a very good way on subject. To begin with, sir, let me hand over the stage to you, and if you can, tell some of your remarks, opening remarks, to set the context on this topic of understanding heart failure.
Yeah. Thanks for wonderful introduction. See, basically, when you talk about heart failure, a lot of people are scared to know about heart failure, or if an individual or the family member suffers from heart failure, they are scared because once we use that phrase failure means it is not able to. See, heart failure is a spectrum of disease. No need to be scared about when we hear about this phrase heart failure. First of all,
Implantations and also complex.
first of all, we should know what exactly heart failure is. If heart is unable to pump blood to meet demands of various organs like kidneys, brain, various other organs of the body, then we call this as heart failure. Failed heart doesn't mean that it's completely gone. As I told you earlier, it's a spectrum of disease. It can be in the initial phase or later phase. Depending on the cause of heart failure, severity of heart failure, we can identify the cause, treat optimally, ensure that an individual who has heart failure can get either cured or optimally treated so that he can have a comfortable life.
Thank
What
you,
we
Dr. Santosh, for your opening remarks and setting the context, and also assuring us that how this can be managed as well. Sir, to begin with, I know there is a lot to talk from an expert like you on this subject, but I'll start with a very very basic question, sir. Many people feel in the society that heart failure and heart attack are same thing, and they offer refer heart failure and heart attack in the same breath. So are these two same things, or is this different? Heart failure is different as compared to a heart attack in which someone has a very huge chest pain.
has the phrase itself tells they're different. See, a heart attack condition where there is a sudden cessation of blood supply to the heart, causing damage to the heart muscle. Heart failure is a condition where the heart is unable to pump blood. This can be caused by heart attack or some other cardiac condition or heart conditions. Hence, both are different. One should understand what are these conditions are, what causes this, and how to go about and treat this and get cured or optimally treated in both the conditions. Both are different.
So basically, you are saying that in a heart attack kind of a situation, the blood supply to the heart will stop, and there would be, acute chest pain and these things. But in heart failure, it's more about the pumping capability of the heart to send blood to the rest of the body. Is that a right differentiation, sir?
Yeah, that's right. You're bang on. Yeah, that's the differentiation. Yeah, heart attack is an acute condition. The patient suffers immediately and can be a consequence. One of the consequences of heart attack can be heart failure, but heart failure per se, this is a consequence of either heart attack or some other condition. Both are different. Both have to be assessed in a different way, and both can be treated in an optimal manner.
Okay. So we know that, if someone faces a heart attack, there is a severe chest pain which happens to someone, and immediately either the patient himself goes to a hospital, or many a times he has to carry it to the hospital as well. So is heart failure also similarly, is it also so serious situation, or is it having a different representation?
No, not like a heart attack. Heart attack happens suddenly, immediately, whereas heart failure is a spectrum of disease. It can happen in a slower way or a sudden way. See, when it happens suddenly, it will be basically a consequence of heart failure. With the patient already has a substrate of heart failure, there's a worsening of heart failure, and the patient becomes breathless, not able to take breath, or can be abnormal heartbeats causing severity of a condition. These are the conditions, these are the things which make an individual go to a hospital or take a medical immediately in heart failure. The patient has a heartbeat variation or a sudden worsening of condition. Otherwise, heart failure is a gradual condition which is gradually progressive and usually have sufficient time to reach a hospital, not like condition where heart attack where we have to reach the hospital as early as possible.
Okay, so that means that the representations are little different. How this will be represented in a patient. So now, if someone is having an heart attack, it's easy to then understand. As you mentioned, there would be severe chest pain and a huge amount of discomfort, and someone knows that he's into a problem, and he immediately rushes to a hospital. But how can someone identify the initial, the signs and symptoms of heart failure? Are there any, major signs and symptoms which you can highlight, which someone should be looking out for?
Yeah. See, basically, when a patient has heart failure or a enlargement of the heart, usually what happens in initial phase, there are a lot of overlaps. It won't be very specific. The individual may be having symptoms like effort intolerance or fatigability or breathlessness and exertion. Any exertion symptoms, usually these things are caused by three main reasons. One, either it's a heart related or lungs related or secondary conditions like anemia or things like that. Whenever an individual has effort intolerance or a breathlessness and exertion or some kind of symptoms which comes on exertion, these individuals needs evaluation. And one of the conditions which can cause this kind of symptom is heart failure or a enlargement of the heart. This is the initial phase. Once these conditions gradually progress and the patient lands up with the later form of the heart failure, then these kind of individual can be breathless, heart rest, or they can have swelling in the leg, unable to sleep. They usually they sleep propped up, having one or two extra pillows, or they're more comfortable on sitting. These are the classical symptoms of heart failure, which are commonly seen in a advanced phase. Whereas in the initial phase, there are a lot of overlaps. It's more of a exertion symptoms. Whenever we have exertion symptoms, we should never neglect, take a medical help, and should get a proper diagnosis. A lot of times it can be an initial phase of heart failure, but if you diagnose at this phase, it can be cured in majority of the conditions.
Okay, so I think Dr. Santosh, for our viewers, has nicely explained that what kind of signs and symptoms can be seen by an individual, which are good enough for him to understand that he may need a medical help. Especially, he mentioned about that on exertion, if there are fatigueness or breathlessness coming in. He also talked about breathlessness and swelling of the feet. And I'm sure that once you look at these things, so some alarm bangs should ring. But what next, Dr. Santosh? If someone has seen, these kind of symptoms, so what are the next steps? Generally, in any cardiac emergency, it is said that okay, go to the nearest facility and get an immediate medical help. But in such kind of symptoms which are not so acute in nature, so should he go to his next door physician? Should he go to his cardiologist? And what should be the next step?
See, whenever an individual has a exertional symptoms, you need to visit a family physician or a nearby physician, because all all these patients may not be having a cardiac illness. As I told you, simple conditions like anemia or low hemoglobin can also cause. Once a physician examines and tries to evaluate what may be the cause of his condition, simple bedside examination can identify anemia, respiratory problem, or a cardiac problem. There are a lot of clinical signs to pinpoint towards a cardiac illness. Once a physician identifies these kind of a clinical features suggestive cardiac illness, you refer this patient either for a cardiac workup or to a cardiologist. Basic investigations like a echocardiogram or ECG can easily diagnose a patient as a heart failure or a heart enlargement, so that further things can be carried out, and cause of this condition can be identified, what is the precipitating factor can be identified, and how optimally these patients can be treated either medically or through some kind of intervention. This can be planned depending on these basic investigations.
Okay. And as you mentioned about the investigations, sir, what are these, what are the diagnostic tests generally, which a doctor will do to identify whether this is heart failure or something else?
See, there are few basic investigations. Most important is clinical examination. 90% of time, clinical examination can identify the patient as a cardiac condition in the form of heart failure or not. Then other investigations like echocardiogram and some blood tests like NT-proBNP, these are very specific to heart failure or an enlargement of the heart. This talks about what kind of a heart disease or a heart failure the patient has, what may be the probable reason of this, and what is the severity, so that medical management or some kind of an invasive procedure can be planned based on this specific investigation. Sometimes in specific group of patients, they also may require some other investigation like in the form of coronary angiogram or cardiac MRI. These are the various subsets of patients who require this kind of investigation. But basic investigation for almost all patients whom we suspect heart failure is echocardiogram and few blood tests like NT-proBNP.
Okay. So with these symptoms, if you have to go to your doctor and if your doctor prescribes these two, three tests, so don't ignore it, and don't say that, go in a sense of denial. So through this basic test, your doctor would be able to then, make out whether you have any heart ailment like heart failure or not. So at this point, if you may also help my viewers understand that these symptoms, who should be looking out for? Now, I'm sure not everyone, and there would surely be certain people or certain group of people who may be at a higher risk of having a heart failure. So, can you highlight, sir, that what can be, those group of people, or are there any specific risk factors for heart failure?
Yeah, definitely. Majority of the medical illness has risk factors. Same thing applies to heart failure also. People who are diabetic, people who are overweight, people who we call a metabolic syndrome, like a group of diabetes, hypertension, or abdominal obesity. These are the people who are at risk of developing heart failure, or people who have diagnosed kidney disease, uncontrolled hypertension, or a family history of heart failure diagnosed in either the siblings or parents, or they have been told to be having some kind of a heart disease by birth, or the patient who has suffered a heart attack. All these patients have a higher chance of developing a heart failure, and these patients has to be evaluated systematically, periodically, to identify whether the patient has early heart failure before the onset of symptoms. It's always better to identify and treat them at the earliest.
Okay, so I think once again, Dr. Santosh has shared these four, five situations or group of patients of individuals. If you have these, situations or such risk factors, uh, unfortunately you may have a little higher chance of having a heart failure, and therefore in your day to day life you should always look out for any symptoms or early warning signs which Dr. Santosh had earlier mentioned. And if you get those symptoms, immediately connect with your doctor as well. So now let's say he has faced someone has faced these symptoms, he's gone to his doctor, and then the diagnostics are also done. Then what next? What's the treatment modality? Is heart failure fully curable to a patient? Is it life threatening? Or how this is managed by doctors generally, if you can guide us?
See, as I told you, there's spectrum of disease. All heart failure are not same because it depends on the causative factors, what might have worsened the condition, and what is the pumping capacity, and what are the other conditions like the patient has some kind of specific subset in a ECG or a cardiac MRI. Few of these conditions can be completely curable, and few may not be. But whatever said and done, there are a lot of medications, lot of implantable devices which can improve the condition at least by more than 50%. Hence, it's very much essential to know what has caused it, what is the severity. Once we do a basic investigation like ECG and echocardiogram, we are going to assess an individual. What we do basically is we have to advise them modification of lifestyle in the form of they have to restrict few physical activities, they have to restrict fluid intake, and we have to look into few blood parameters to optimize the medication. And there are few medications, basically we call as a four pillars of heart failure treatment. These four pillars are very much essential. Usually in other conditions, what we do, we give medications and either we down titrate in the case, but in this specific condition, we have to up titrate so that we have to optimize the medication and give the maximum benefit to the patient. Up titration is very essential in this kind of a medical condition like heart failure. And in few subset of patients, especially patients who have something called the left bundle branch block, there is some implantable device called a CRT or a left bundle pacing, which can normalize the basic electrical problem in the heart just caused heart failure. And in fact, it can even normalize the heart problem, and patient can get even cured also. Hence, it's a spectrum of disease, causative factor, specific factor, and severity of disease matter, and significant number of heart failure patients can get cured by this disease, um, and majority of these patients can get improved by more than 50%.
Okay, so you're saying that there are multiple management techniques, and many patients will get treated also to a great extent. But then, sir, how about is it like the doctors are going to do the thing which you mentioned, maybe medications or implanting devices? Now, what can the patient himself do to manage his heart failure situation in a better way? Do you recommend any lifestyle modifications in a patient's life
So
is controlled in
definitely,
a better in a
see,
good way?
as we're discussing about precipitating factors or risk factors management is very much essential. Like for example, a patient with diabetes, he is overweight, he consumes alcohol. These are risk factors which can worsen heart failure. He has to optimally control his diabetes. He has to cut down his carbohydrates, do regular exercise so that his sugars are well controlled. And heart failure patient should never take alcohol. That's very much essential. Otherwise, his heart pumping capacity is going to go down and he can have arrhythmias or heartbeat variations. Third, he has to stop tobacco smoking if he's smoking. And he should know his physical activities depending on his pumping capacity. If the patient has a very bad pumping capacity, they may have to restrict their physical activities or otherwise not required. And the fluid intake also depends on the pumping capacity. Depending on various condition, clinical profile, a doctor, the medical caretaker going to advise all these modifications about his diet, fluid intake, and his kind of exercise and various other stuff so that his lifestyle is modified to suit his heart pumping capacity so that heart gets sufficient rest to recover. That's very essential, very much essential. Heart should get sufficient rest to recover. That's very much essential.
Okay, so these are some of the techniques which Dr. Santosh mentions, and I think these are some of the controllable things for individual patients as well. as you mentioned, of smoking cessation, or some of the dietary recommendations. And I'm sure every patient is different. Would the prescription of lifestyle modifications be same for every heart failure patient, or again it will be different for different set of people, Dr. Santosh?
Definitely, we have to customize everything, not only lifestyle modification, with the medications or form of therapy we offer. See, as I talking about implantable device like CRT, we can't offer to all patients. There are a subset of patients who won't get benefited. Hence, we have to customize the patient. We have to modify. We have to advise the modification depending on the medical condition or risk factors or the heart pumping capacity the patient has. You can't generalize advice to these kinds of heart failure patients because it's a spectrum of disease. It's not like a single disease entity.
Okay. Sir, also, many people tend to ignore such symptoms of heart failure, like normal. So let's say if someone is having a breathlessness, he knows that, he's uncomfortable, but then it's not very severe chest pain. So many people, will ignore it. They feel that if I go to a doctor, if I go to a hospital, I may be hospitalized, because that's a normal perception that for a cardiac ailment, someone will have to get hospitalized or undergo procedures. So, is this true in a heart failure situation? Does every patient need hospitalization, or you can treat the patient even on an OPD basis?
I think it's a wrong conception. Every patient does not require hospitalization. Actually, in fact, amongst heart failure patients, maybe hardly 5% patients require hospitalization. What they require is basic understanding of the disease and what they have to modify at their house. And they have to take medications and modify their lifestyle. For example, they're taking more amount of fluids, you have to cut down the fluids. That itself will take care of majority of the symptoms. And 95% of these patients, when they have acute worsening, they don't require hospitalization, they require hospitalization of medication, optimization medication, especially maybe we have to titrate few drugs like diuretics. Hence, one should not go with the conception that once you reach a hospital or meet a physician, they'll hospitalize a patient of heart failure. No. Yeah? Only 5% of patients of heart failure when they are worsening require hospitalization.
Okay, I think that's a major myth which has been clarified by Dr. Santosh. So, if you have symptoms of heart failure, please don't ignore them. Don't have a fear in mind that it may be a very long haul and you may get hospitalized and then long procedures. No, that is not the truth. In fact, if you don't visit your doctor or your cardiologist timely, then you may get into a serious situation and may require hospitalization in that case. So don't ignore your symptoms, and visit your doctor immediately. So as we are running out of time, and I must thank, like, you have been answering all these very very basic questions as well, despite your expertise. I want to just ask one or two last questions on this factor, that uh, now, is heart failure, where do we stand medically? If someone has have now diagnosed heart failure, then are there enough treatment? And if the patient is also, let's say, he reaches the hospital in time, then is the treatment today available to fully cure the patient, or let's say, can he have a healthy long life with heart failure? So as an expert electrophysiologist and a cardiologist, what's your guidance on this?
See, basically, one thing what I want to highlight here is we are we are reaching a phase where we are going to a pandemic of heart failure. That means basically we see a lot of patients who are landing up with heart failure, basically because they ignore the initial symptoms of heart failure. They're not able to take a medical help in the initial phase of heart failure. And there are a lot of myths and confusions amongst patients regarding management of heart failure. See, one thing I want to ensure is 99% of the heart failure is treatable, even though not curable. Only thing is, we should never ignore initial symptoms of heart failure. Reach the hospital in time. If you reach the hospital in time, hardly any fear of heart failure succumb to the illness. And lot of times they need proper evaluation. It may take some time. It may not be in hospital. It can be on outpatient basis. And some such subset of patient may require invasive procedure, and definitely they're going to get benefit of this invasive procedure. Hence, understanding identifying, reaching the hospital at the right time, getting a proper medical care at the right time, ensure a patient of heart failure reach a normal, comfortable life, maybe with medications and with some modification of his lifestyle, but it will ensure that they're going to lead a comfortable life.
Well, I think those are very, very reassuring words from our expert today. That majority of the heart failure situations are treatable if the patient is reaching on time and following the doctor's advice. So these are some very reassuring and positive words. So therefore, I think what is important for the viewers and patients who may be suffering with heart failure is, please, if you are having the risk factors as elaborated by Dr. Santosh, then look out for the early warning signs and symptoms. Identify timely and seek the medical care from your doctor. And if you are following your doctor's advice, whether related to lifestyle modifications or related to treatment modalities, then the chances are that you are treatable, or it will be your situation will be managed to live a long and healthy life. Um, Dr. Santosh, thank you so very much. I must thank you. I think the way you have elaborated on all these important points to our viewers today. To all our viewers who have watched us live or who may be watching this program later on, I may request you that if you have anyone in the family or in your friend circle who have family history of diabetes or the risk factors like diabetes or other things like breathlessness, you can simply share the link of this program with that person, and this conversation, which will be available on Facebook and YouTube, may just be very, very helpful for them as well. But before I say goodbye, sir, let me hand it back to you for your closing remarks. And if there is anything important which we have missed to cover in this conversation and you still want to highlight.
Thanks a lot, Sanjeev. I think one thing what all of us understand is heart failure is a spectrum of disease. People can have various symptoms depending on the phase of heart failure. Never neglect exertion symptoms. The patient has breathlessness, palpitations, or some fatigability, horn exertion. Never neglect. Meet a physician, take a medical help. It can be a early symptom of heart failure, but this is a phase where you can get cured. If heart failure or any other medical condition is in an advanced phase, getting cured may be difficult, but it's not impossible. Hence, don't just go by hearsay or some kind of a social media messages. Meet a physician. Majority of these can be treated, cured optimally. Never neglect your medical condition, especially heart failure. And nowadays we have lot of varieties of treatment to treat this medical illness. Basically, it's a patient-centric disease. Otherwise, what happens? We are, especially us, we Indians, are reaching to a phase where in maybe in a decade or two, we may be having very high burden of diabetes or heart failure in our country. This basically, you can reduce this purely based on the patient response. It's very much essential. I think once a patient or a family is aware of this kind of symptoms or when to take a medical help, I think we are going to decrease these kind of a medical illness significantly, so that we are going to treat a patient optimally. The burden to society, family is going to come down if we treat this kind of a chronic illness like heart failure. Thank you.
Well, thank you so very much, Dr. Santosh. So, on this note, we conclude this program and say good night and goodbye to all our viewers. If you are in Mysore or nearby areas and you want to have more information or face any such problem, you can always visit Dr. Santosh. He's at Sri Jayadeva Hospital, Mysore. Or if you are in other cities, don't ignore the symptoms as the doctor mentioned and meet your nearest doctor at the earliest. Thank you so very much, and good night and goodbye.
Thanks, Sanjeev, and the team, and thank all my viewers for giving an opportunity.